Good afternoon. My name is Trenton Ellis. I'll be your nurse today. Can you tell me where you're at?
I'm at Rosenson College.
Yeah? What's your name?
Kimberly Fisher.
And your birthday?
12/13/90.
Alright, you're oriented ×3. Your posture is okay. It's a little slouched. Your appropriateness of speech is okay. And your hygiene seems alright. We're going to move from that to your face. Now I have a pen light somewhere, but we're going to start with your eyes. Alright? We're going to assess for accommodation or perla, and I'm going to look into them real quick just to see if they contract like they should, and if they do. So you should look out into the distance, and I'm going to bring my finger in between your vision, and then focus on my finger from there, right, just so your pupils should dilate to it. Okay, good. There's no lesions, there's no redness or anything, it's free of anything in your eyes. Okay, let me see your nose. Head up for me, look in there. Okay, it's free of debris or anything. Did you try to breathe in through each nostril for me? A big deep breath. Okay, no sounds of anything. You open up your mouth for me. A few cavities. No signs of cyanosis or cancer in there left to hide under the tongue. A good amount for oral hygiene. I'm going to check your ears now. Alright? I'm going to pull. For an adult, you're going to go up and back. Open up the tympanic canal. I'm going to let through there. You see that there's no wax or redness or anything like that. It's healthy. I'm going to close your eyes for me. I'm going to assess for sensations in your face and tell me where I touch you, alright?
Forehead. Chin. Nose.
Okay, you passed. You should keep your eyes closed. I'm going to do what's called a whisper test, so you're going to repeat what I tell you, alright?
Pillow.
Okay.
Shoestring.
Okay. Whisper test is passed. I'm going to move on to your thorax and your lungs. Okay, I'm going to assess for an accessory breath or like a presence of a cough, and there's not one when you're trying to breathe or anything like that. And then we're also going to assess for the abdomen shape, or the size of here is equal to 2 of these, which is, we're also going to assess for posture, or spinal curvature, which is just fairly straight. There's nothing abnormal about it. And then the thorax, I'm going to assess your lungs in 16 different spots that you're supposed to assess for. I'm going to start with your back. Alright. You take a deep breath every time I move my stethoscope, okay?
Okay.
Raise up your left armpit for me. Let's start here. Lift this up. Other side. Okay. Now go to the final 6 on the chest. Deep breaths for me. Okay, that's good. First, I'm going to check your carotid arteries moving to your heart. Making sure to do one at a time so you don't block the blood to the brain. Which is good. Heart sounds. Starting from your right side. Your right sternal border, second intercostal space, is your aortic. So first one, and your second one is here. your sternum border. Moving to your pulmonic, left sternum border, second intercostal space, pulmonic. Okay, left sternum border, third intercostal space is Erb's point. Left sternum border, fourth intercostal space is the tricuspid. And the fifth intercostal space, mid-clavicular line, is right under the breast, so if you want to lift that up for me. Alright, that's good. You have your light out. Check the shape of the abdomen. It's flat. Okay. We're going to auscultate before we palpate for abdominal sounds. Starting with the lower right quadrant. Starting with the upper right quadrant. Upper left. Lower left. Palpate. Tell me if this hurts anywhere. Rebound tenderness or feels bad. No pain whatsoever.
Nope.
Percuss. Anywhere else? All right. And then, how is your bowel movements or urinary habits? Normal, you'd say, or?
Normal.
Yeah. When was the last time you went? Number 2, as they say.
This morning.
Yeah.
Mhm.
Urinary's fine. Everything like that.
Yep, about an hour ago.
All right. All right. Would you sit up for me and have your legs hang over the side? And I'm gonna do your 7 skeletal muscles. So 1 o'clock. 1 minute. Okay. We're going to assess your muscles for size and symmetry, and they're equally the same. And symmetry is also the same size on each side. We're going to palpate check your extremities for edema, tenderness, lesions, temperature, things like that. Here's your feet. Okay. Let's see the range of motion of your neck. Go each side, back and forth, up and down. On your arms. Range of motion. One for me. This way, bending this way. Yep. Your feet too. Alright. Assess for strength. I'm going to try to pull on you this way, hold it. I'm going to reverse it. Try to push. Arms. I'm going to pull you. Same. Okay. We're going to assess for capillary refill. Slight pressure on it for just a second. So it comes back. Rapidly comes back. It's good capillary refill. No lack of circulation. We're going to assess for your range of motion. And not just your neck and your legs and arms, but at the joints. Are you free to do all that? Legs as well. Can you stand up for me, please? And, close your eyes. Just stand as straight as possible. Okay, so open your eyes. You walk over that way for me. Sit back down on the table. I'm going to assess your pulses for the symmetry, strength, rhythm, rate, for all the pulses. I'm going to start with you. Your salpingus. Sorry. All right. So you hold out your arms like this for me. I can make you any more comfortable than you already are.
I'm in the glass water, please.
Glass of water. There you go.
Thank you.
You're welcome. All right, I'm going to wash my hands, give you some privacy, and if there's any other thing, I'm going to go document when I find it, all right?
Okay.
Thank you.